Good evening, everyone.
Good evening.
Welcome to Medical Mondays. I am Dr. Toyin Okpesomi, a family practitioner, HIV specialist, and I treat addictions in several areas in Maryland. Tonight, we're in for another treat to learn some things that we probably have taken for granted, and I'm sure things that we don't know about at all. We have with us tonight Dr. Ajagbe, who is a dental pathologist, a dentist of dentists, very knowledgeable, who will be talking to us about jaw deformities, crooked teeth, and how all of this impacts our physical health. So join me in welcoming Dr. Oluwole Ajagbe.
Good evening, everyone.
Good evening.
I'm glad to see you again. This evening, we're just going to spend a few minutes on, on jaw deformities. I'm sure many of us have observed in our spheres of influence, many people with different facial appearances. And sometimes we assume that those appearances were fixed because they were genetically underwritten. But in most cases, it's because of the limitation of our understanding of how these things are. Tonight, I will try a little bit to simplify what it is that constitutes jaw deformities and, simplify it to the point where you can understand as a layperson hearing me talk about jaw deformities and the consequences of jaw deformities. Tonight, next slide, Dr. O. I want us to know that there is a hidden epidemic that we are not, most people are not aware of, and that is the shrinking of the jaws. Many of the scientists who study anthropology have observed over the years that there is a marked difference or a shift from the jaws of those ancestors before agrarian and industrial revolutions. Comparing the jaws and the skull have shown a marked difference or, a shift. And that is because there is so much going on in terms of environmental factor that is affecting the development of the jaws. Now, if I can quickly just go over some of these things, you might be able to understand it. For those who are in the childbearing age, or if you have passed that childbearing age, for women, when they are pregnant, they are often asked to take folic acid. Folic acid is a supplement, is a vitamin that is supposed to help in the development of a newborn. Folate deficiency could easily affect the development of the neural tube, which is what is going to develop into the brain and the spinal cord, as well as the structures of the face and the mouth. Any defect as early as within 24 hours of conception could, detrimentally affect the development of the brain, the spinal cord, the face, and the jaws, as well as the mouth. So what we are trying to see now is, why are we seeing the shift in the direction of the shrinking of our jaws? How would you know that there's been a shift? if you can change to the next slide, please. It's been observed by researchers in Stanford University in California that the shrinking of the human jaw in modern humans is not due to genetics, but is a lifestyle disease that can be proactively addressed according to the researchers. So what am I trying to address? I'm trying to let us understand the fact that the shrinking of our jaws, when we observe it in many of our relatives or even just acquaintances, may not necessarily be as a genetic, inheritance from their ancestors. So what do we need to know when we already understand the fact that this may be a lifestyle shift? What we need to understand is this. As we embrace the Western civilization, we also embrace many of the habits and the way to do things. One of the areas is in breastfeeding. Most of the time in the Western world, many mothers are not interested in breastfeeding, although there are so many awareness, educational programs going on, trying to encourage, new mothers to breastfeed their babies. Now, we've observed scientifically that children that were not breastfed for extended period of time when they were born will eventually develop jaw deformities. The reason being the fact that the exercise that is inherent in breastfeeding will be absent, and that will be necessary for the development of the tongue as well as the jaws. When this is absent, when this type of exercise or during breastfeeding is absent, the jaws are not formed properly. They are underdeveloped. Next slide, please. So the jaw epidemic is very serious, but the good news is we can actually do something about it. There is, we've gone on for a slide faster. But anyway, so can go back one more slide. Yeah, we can see that this is not something, go on to the next slide, the map. Thank you. We can see that epidemiologically, there are 74% of adults in the United States of America that actually have signs of jaw deformity. But everybody seems to be living with their jaw deformity, even after some will have gone through braces, they've gone through surgery. Some of the times the situation still persists. Next slide. What we found out is that when the jaws are not well developed, the first thing that we will observe clinically will be the crooked arrangement of teeth. The reason being very simple is if you have 32 teeth and you do not have enough space for them, they have to be crowded. They have to be misaligned. They have to be arranged in haphazard fashion. And that is one of those things that we observe clinically. Now, when this is the situation, most people, if they don't have awareness about the possibility of help, they will continue to live with this situation. But I just wanted to tell us that there is help, available for anyone who is experiencing this jaw deformity that is leading to crooked teeth. Next slide, please. Okay. So what are the causes of malocclusion? What do we call malocclusion is simply the same thing as crooked teeth. When your teeth are not lined up properly, if you look in the mirror, there are some, climbing on top of each other. Some teeth are biting inside the upper teeth are biting inside the lower teeth, and all of that kind of arrangement will be defined as malocclusion. Some of the common causes, or etiologies, if we want to address it that way, are this: cleft lip and cleft palate can result in malocclusion. Frequent use of pacifier after the age of 3 in children can cause the teeth to be bucked and an open bite to result. So there will be malocclusion. Prolonged use of bottle feeding in early childhood. Thumb sucking. These are some of the habits that we need to bear in mind if we are, if we are childbearing parent. Injuries that result in the misalignment of the jaws can also cause malocclusion. When we have tumors, cancers of the bones, cancers of the soft tissue, this can cause the teeth to be pushed out of alignment. Abnormally shaped and impacted teeth, many times because there is no sufficient space for all the teeth to come out side by side, some of them will be crowded. Sometimes the teeth are they are malformed because of congenital abnormality. And many times poor dental care that results in improper fitting dental fillings and braces can cause malocclusion as well. Airway obstruction, mouth breathing potentially caused potentially caused by allergy can cause enlarged adenoids and tonsils in many children. Next slide, please. What are the symptoms of crooked teeth? I already mentioned them in passing. The first thing you will see is that the teeth are not aligned properly. There are also alteration in the appearance of the face. In most cases, the face are not uniform. Sometimes the face look longer than normal. Many times people are constantly biting on their cheeks or their tongue when they chew inadvertently. Many times they have discomfort when chewing or biting. Many children and adults that have misalignment of their teeth cannot speak properly because they have lisps, and they can't, because their teeth are open in the front. Their teeth do not come together when they need to pronounce letters like S or makes S sound or any such sounds that will cause the teeth to come together in the front. Many of the people that have malocclusion are mouth breathers rather than breathing through their nose. Next slide, please. So I'm going to show you a few examples of crooked teeth. Many of them are not as graphic as I would love them to be because I don't want to scare many people tonight. But I'm going to show you just simple examples of what crooked teeth could look like. Next slide. The first one would be overbite. What do we mean by overbite? Overbite is when the upper teeth are almost covering all the front, bottom teeth completely. That when somebody show their teeth, you can only see their upper teeth without seeing their lower teeth. That's the next slide. You see that. This is what we call class 2 malocclusion in dentistry, and most of the time they can be fixed very easily. What you can see here is if there is an excessive underdevelopment of the lower jaw, it will cause the tongue to be trapped towards the back, and this will cause the airway to be compromised. Next slide. Underbite. Underbite is when the upper jaw is developing behind the lower jaw. And you can see it is a situation where the upper teeth in the front are biting on the inside of the lower teeth. This is what we call prognathism. That is when the chin sticks forward more than the upper jaw. Next slide. Crossbite is, yes, crossbite, if you go, yeah, thank you. Crossbite is when the teeth are really, really crooked. Some teeth are biting outside. I mean, some upper teeth are biting properly on the outside of the lower teeth, while some are trapped behind the lower teeth. And this is the situation. It could be only a few teeth, or it could be most of the teeth on one side, that will be trapped. That is the upper teeth being trapped behind the lower teeth. Next slide, please. Next slide. So the next slide, the next manifestation of, malocclusion is when you have excessive spacing between teeth. Next slide. Yes, thank you. When you have spacing between the teeth, it also shows that either the teeth are small for the amount of space that you have in the jawbone. And so even with this, you may have inefficient chewing, because if the teeth are not lined up properly, despite the fact that you do not have crowding, the patient will still be uncomfortable. And many of these can be treated. Next slide. Crowded teeth, this is the one that, next slide. Crowded teeth is when you can see obviously, definitely, that the teeth, there are many more teeth than the space that is available for them to stand side by side. And in this case, you may have it just in the upper jaw or in the lower jaw, or it could be in both of the jaws. Next slide. So the next slide is just, to let us know that there is a correlation between a jaw underdevelopment or jaw deformity and breathing. And most of the breathing problems are not observed during the day except for mouth breathing and nose blockage. Most of the sleep and most of the breathing disorders are observed more severe or more drastic during the time of sleep. So what we try to do is just to make sure that we see there is a correlation between the jaw underdevelopment or malocclusion and breathing disorders. So at this point, I will want to take I will stop right here because I think we've gone for about 15, 20 minutes. We will continue with a question and answer, and I'll be able to address more of the issues to deal with at that point. Thank you.
Thank you so much, Dr. Ajagbe. Excellent presentation. Oh my gosh. So we know what happens when we see all those crowded teeth. And so how does it impact health? Other than, you've talked about chewing. Some people would have difficulty chewing food because of the malalignment of the teeth. But do they have any impact other than that?
Yes, absolutely. I didn't want to crowd you with a lot of information at the beginning. They impact overall health in many ways. The first of them is in the area of airway compromise. The upper airway, as you know from anatomy, is actually part of the development of the jaws. With underdeveloped upper jaw, the nasal cavity will be very small. Many times the nasal septum is deviated or displaced so that there's constant nasal blockage. Nasal blockage will cause the people to be mouth breathers, and that is one important part. And we know if we don't get enough oxygen, the brain will suffer, and every part of the body also will suffer. Let me just stop at that point for now. But another thing that you can really see directly related to malocclusion is the ability to clean the teeth properly. If the people are not able to clean their teeth properly, they will have cavities, they will have gum disease, and we know that gum disease affects the cardiovascular system as well as causing nutritional issues. So we're just going to address it as one by one along the way. I can hear you. You are muted.
Pardon me. I said, thank you so much. So I just want to throw it out there that if anyone has a question, they can raise their hands and ask the question or put it in the chat box. Whichever one is comfortable for you. So these teeth malocclusions, do they affect sleep in any way? Because
yes.
Obstructive sleep apnea is a huge thing now. We
Yes.
know the consequences, and we'll discuss that in a few minutes, but do they have any impact on sleep?
Absolutely. Yes. As I was trying to explain earlier, the jaw bones, particularly the upper jaw bone, surrounds the nasal cavity. It is in the upper jaw bones, the left and the right one, that you have the maxillary sinuses. The sinuses are very, very important in respiration, in breathing. One of the important reasons why the sinuses is really important is this. The lining actually forms the nitric oxide. The nitric oxide serves a big purpose in disinfecting the air that goes through the nose into the lungs, so that the lungs does not get infected very easily. At the same time, nitric oxide causes vasodilatation, that is, opens the blood vessels. The small blood vessels in the lungs, they need the nitric oxide in order for oxygen to go in and carbon dioxide to come out. Most of the time when the jaws are not fully formed, the nasal cavities are blocked for most of the time, either from allergies or from, just rhinitis, that is inflammation of the lining of the nose. And once the nostrils are blocked, it means the mouth will be the default for breathing. And once the person cannot breathe through the nose, start breathing through the mouth, there is a lot of problems. One of them is the inflammation of the tonsils and the inflammation of the adenoids. And the next thing is the mouth will always remain dry. And in the dry mouth, you have increased formation of plaque. When you have increased formation of plaque, it means there will be increased incidence of cavity as well as gum disease. And all of this put together eventually affect the heart. And most of these patients are the ones that will have lung problems. They will have asthma. They will have chronic asthma for a long period of time. If not well treated, many of them could actually die from the severity of their asthma. So malocclusion affects everything, not just the respiration, not just the breathing. It affects every system of the body. Hello? And when you ask about the sleep apnea specifically, yes, when there is compromised airway, definitely when the patient sleeps or the individual sleeps at night, they do stop breathing for more than 10 seconds. Some of them can stop as many as, as few as 5 times per hour to as high as 170 times per hour. And that is very serious because every time the person stops breathing, it means there is no oxygen intake into the lungs, and that means the brain is being starved of oxygen. And that is what is being described as obstructive sleep apnea. Many of the times it's because the airway is very narrow because of the underdeveloped jaw, which traps the tongue towards the back of the throat, and that causes the airway to be blocked when the patient is sleeping or the individual is sleeping. Now, all of this can be treated not just with CPAP, but we now have ways of growing the jaws and be able to create space for the tongue in order for the individual to be truly treated, or actually, to some extent, we can say cured of the sleep apnea.
Thank you so much for that answer. Because I just want to interject and say something. We have lots of people on this forum tonight that are of childbearing age and that, can make a difference in their babies, in their children. But for the rest of us that are grown, I want us to realistically look at our teeth health and see, and, just look to see if there has been a change in your teeth. I see a lot of my patients these days coming to me, telling me that they notice that they have crowding, usually on the bottom, and that it didn't used to be there. So when you started talking about something that can help us to fix this permanently, when I used to see that, I used to think, okay, they're going to lose their teeth, which is what normally happens. The teeth crowds, then you start seeing that they start losing bone, and eventually they start losing their teeth. In Africa, they would say they were using some medicinal stuff that caused them to lose their teeth eventually, but that's not the case. So thank you so much for what you have taught us, because from what you have taught us before and what you have taught tonight, it is obvious that most of us have issues with our jaw that can be fixed so that it's a permanent resolution to that crowding that will prevent, the loss of teeth, that will prevent maybe sleep apnea, or, cardiovascular health. Because
yes.
Then cause gum disease that then cause cardiovascular disease, which is the #1 cause of death now in both and females.
Yes. May I just say one thing right there?
It's your talk.
Hello?
I said it's your talk.
Yeah, let me just say real quickly. Many times we assume, well, particularly from Africa, that, oh yeah, when you see things, your teeth shifting, you think, well, they will go back to normal. Or sometimes, you just say, well, my father had it, my grandmother had it, so it's okay. No, many of these things can be proactively prevented. And that is, you need to know what is really going on with your teeth. For instance, when I see somebody with their lower teeth becoming very crowded, I'll let them know that as they get older, the chances of losing bone increases. And the reason is if they are not very meticulous with flossing of their teeth, particularly in the areas where the teeth are crowded, they will, it's just a matter of time, they will lose bone. And when they lose bone, the teeth are going to start drifting in different directions that they do not want them to go. And that is a big problem for those who will eventually lose their teeth prematurely. Yes, you are absolutely right when it comes to inability to maintain very healthy oral habits. That is, the gums are infected. They have subgingival, cavities. That is, they have cavities below the gum line. When they have cavities below the gum line, eventually they will lose those teeth because root canals will be very difficult to do on such teeth because the cavity is below the gum. And as we get older, we need to bear in mind that most of us will not have enough clearance of saliva in our mouth as we used to when we were younger. Anytime there is the reduced amount of salivation, there will be increase in plaque formation. Plaque is a little film of material that forms on the teeth. When you wake up in the morning and you run your tongue over your teeth, you feel like something just kind of cover your tooth surfaces, and that is what we call plaque. When you brush it, your teeth will become shiny and smooth again. If you left that plaque for a long period of time, chances are that you will develop cavity and you will also develop gum disease. So, and if you don't attend to those two, you will eventually lose teeth. And when you lose your teeth, it will cost you more money to try to replace them. Another thing I need to let you know about the issue of spacing and crowding is many of our people, or Africans, have what we call the medial diastema. That is, they have gap between their front teeth. When they were younger, these gaps were very small. But as they get older, the gap, the space between their front teeth gets wider and wider and wider and wider until many of them will eventually lose the two teeth on either side of the gap. Once they lose those two teeth first, it's just like domino effect. They will begin to lose the remaining teeth one by one because there is no more support that they used to have. What we have found out is that, it's already known that most of our people, or most of the people in our community, do not go for checkup or regular checkup and ask questions about the spaces between their teeth, because they assume for some people it's a sign of beauty. Oh, they love it because they have space between their teeth. They love to show it off, but they don't know that actually it may be because the frenum, that is the small strand of tissue that is under the lip, if you pull your lip up, you see a little fold of tissue that comes to the jawbone. If that is highly attached to in between the two teeth, the teeth will continue to drift apart. As you use your lip, whether you are talking or eating or drinking, is causing the teeth to drift apart. And that can be treated very easily by just doing a minor surgery to relieve that attachment. And so you don't want to lose your front teeth because your gap is constantly getting wider. I thought that was something I needed to pay attention to tonight, to let people know that when they have gaps between their teeth, it may seem beautiful when they were younger, but once it starts getting wider, it's a thing of concern.
Thank you so much. There is a question here by my sister Edna. I love that question. And it's one that shows that she has been paying attention to her surroundings. It goes, what would you suggest is a good dental hygiene every day? Sorry, how come As people age, their teeth get closer to their gums. Pardon me.
Their teeth get closer to their gums. Well, I'm assuming that she's saying, I'm assuming that the question is addressing the height of the teeth, that the occlusal plane, that is, the teeth are getting shorter. Is that what she means?
I think it is when somebody starts losing bone where you stop. You see how?
No, when it says they are getting closer to their gums, I'm assuming the teeth are wearing down as they use them.
Sister Edna, can you unmute and ask your question? I'm looking for you. There you are. Can you unmute, please? There you go.
My question is, we Africans, we chew a lot.
Yes. Mm-hmm.
As you grow older, I have noticed it on my own. As you grow older, the teeth will be kind of short, getting smaller, like like a person is shrinking, getting shorter. It's not as long as it used to be when you were young. I have noticed this in so many, African people because,
Yes.
why is that?
Yes, I believe that I understood your question the first time. Thank you for clarifying that. Yes, the issue is very straightforward. You already observed it accurately. When you chew hard stuff, it's like you are filing down your teeth over time. All right? The teeth of somebody who is 70 years old, who used to grind his or her teeth habitually, whether when they were sleeping or they were trying to concentrate, the teeth will get shorter, because it's like somebody files away the teeth over time. Slowly but surely, the teeth will get shorter. The problem with that is this: there are two things you must observe. They don't look good over time when your teeth are very short. Number two, it affects your joint, the joint of your jaws. If your occlusion is shorter than before, it means you are laboring your joint more, and that is going to cause chronic headaches. And that is something that most people would not be able to explain why they are constantly having headaches. It may just be because their teeth are now too short compared to when they were younger. The other thing is, many times when the teeth get shorter, the nerves inside the tooth or inside each tooth becomes exposed over time. And once they get exposed and you wear them down, it means almost all the teeth are dead. Because if all the nerves are already gone because you wore them down, you wore the teeth all the way past the centers of the teeth, it means the teeth are no longer alive. Well, you will not have pain because you've endured it over time, but chewing would not be as efficient, and the TMJ and chronic headaches might be what somebody will be experiencing on a constant basis. So there is a solution for that, though, and it's always expensive. The solution is to increase the bite, because right now the bite is worn all the way down to the gum line. And what the dentist will need to do is to build your teeth back up to what it used to be when you were much younger. And then, of course, they have to tell you, or we have to tell you to watch your habit, and we have to help you to kick the habit of grinding your teeth over time.
Thank you so much. Is it the same as eating chicken bone and, chewing, those goat meat bone, cow meat bone? Is it the same?
Well, it depends. If all you are doing is just occasionally chewing those bones, crushing them, and without cracking your teeth, you'll be fine. Okay. But when people are constantly chewing coarse substances, anything, people like to chew bitter cola, they love to chew cola, they love to chew nuts, particularly hard nuts. Everything that causes abrasion when you chew is like you are filing your teeth down. But the most important cause that we need to bear in mind is grinding the teeth because of sleep apnea or because of habitual grinding of teeth and clenching. Those are the worst of the causes for losing the teeth in terms of their height over time.
So will mouth guards help that?
Yes, there are many ways to help those who have the, who are complaining of grinding or clenching their teeth. Many times when you go for a dental checkup, we ask, do you clench? Do you grind? Many times, particularly from community Africans, oh, nobody wants to say they grind their teeth. They say, oh, no, I don't grind my teeth. But when you catch them grinding their teeth and you tell them, look, you are grinding your teeth, say, really? No, I don't think so. But it's not about denial. It's just recognizing that this will have a very bad effect over time if you don't kick the habit. So if I find somebody next to me grinding their teeth, I would politely tell them that, sir or ma'am, it looks like you're grinding your teeth. Is everything okay? If they don't want to talk about it, it's fine. But I will suggest to somebody like that, unsolicited, please, when you visit your dentist next time, just tell them that you grind your teeth. They might be able to help you. That's the kind of thing that I would like to do. So grinding is very, very dangerous over time, but most people don't know it. Now, I need to add a caveat to that. When people have sleep apnea, obstructive sleep apnea, when they stop breathing and the brain kicks in to arouse them to start breathing again, the first thing that happens is the jaw moves forward. The jaw moves forward to move the tongue away from the back of the throat involuntarily. They don't know that they are doing that. And if they do that, like about 90 times per hour, and they sleep for 8 hours, you can imagine how many times they've ground their teeth without knowing that they have ground their teeth. And because that occurs involuntarily, they will not say, in fact, they don't know. They don't know that they've done anything. And it's true, if you ask them, did you grind your teeth at night? And they tell you, no, I don't. It's because they don't know. They could not have found out unless somebody told them, I heard you grinding in the night. Wow, that was very loud. And maybe they will be aware of that. Most people are not aware that they do grind their teeth, particularly those who have sleep apnea. But there's help. There's help, and that is you need to find out that you have sleep apnea, particularly if you wake up in the morning grouchy and you have excessive daytime sleepiness. That is, you are driving and there's red light and you fall asleep for 5 seconds and you wake up and somebody is honking behind you, you know you have a problem. If you're not watching it, it's going to be very deep, it's a dangerous pathway. But what I'm trying to say here is this. There is simple diagnosis available now. You don't have to go to a sleep lab to spend about $2,500 per night to get a sleep study done. You can actually have a sleep study done in your house in your own bedroom just by wearing a single ring, a ring that has one sensor that will not only measure how many times you stop breathing at night, it will also measure the sleep pathology as well as the quality of sleep. So at some point, I can show that picture to you, to everyone, so you can have an idea what I'm talking about. It's not something very expensive as of now.
So can you put that in the chat box for us, please? How people can get that, because I know you have access to that.
If you quickly share your screen again, and I can show you, you can quickly show the picture on my slide. It's towards the end.
I'm talking about the information to get it from you.
Okay. Yeah. All right. I'll do that.
So there's a question here. What would you suggest is a good dental hygiene every day and products to use?
Well, that's a very common question. For instance, let me just say the magic word or the magic number that everybody knows is always 2. When you talk about dental issue, you say 2. And say, how many times do you brush your teeth a day? People will say 2 times. When you say, how many times do you visit your dentist in a year? You say 2 times. Well, if 2 is the magic number for dental oral healthcare, I would say to you, what are you trying to clean? That's the question you must first answer. If you don't know what you're trying to clean, everything you are doing may just be off. If all you are trying to do is to clean a thin film of, leftover food from last night and new deposit from your saliva overnight, I don't think you need a scorer to do that. You need something gentle, something soft enough if you are doing it on a regular basis. Particularly if you say that you are brushing your teeth twice a day. You do not need the hardest toothbrush in the whole world in order for you to get a clean mouth. If you are doing a good job from the get-go, there will be no reason for any leftover to be on your teeth after brushing. Some people will ask me, when do you floss and when do you brush? Well, is it flossing before brushing or brushing before flossing? Personally, when I do this, I floss first. The reason I floss first is very simple. If I have a plaque between my teeth and I'm using the floss to floss my teeth and I'm going from tooth to tooth, there's the tendency for me to push some of the, the plaque from between my teeth to come on the surface. Where my brush could easily clean them off. But if I already brush before flossing, then it means if there's something that comes from between my teeth after brushing and I'm not brushing after flossing, then I will still leave some plaque on my teeth. So the straightforward answer will be brush your teeth, make sure everything that you felt with your tongue on your teeth is cleaned off. If you can achieve that, then you don't need to do anything extra. I do not sell any particular product, so I'm not endorsing or negating any particular product. If you know that all you want to try to do is clean the plaque off of your teeth, anything that can do that for you is fine. There's so much hype and so much sales pitch about fluoride, triclosan, and all kinds of additives put into dental, like a toothpaste in order for people to buy. Any toothpaste you choose to buy is fine, but make sure you use the toothpaste properly. If you don't use the toothpaste properly, you might as well don't use it. Don't use too much. Put a little bit on your toothbrush. It's just for you to get a little bit of lather when you brush your teeth. which I believe you don't even need toothpaste to keep your teeth clean. Personally, I use baking soda and hydrogen peroxide every day for the past 15 years. When I made up my mind, I wasn't going to be using toothpaste anymore because I could get a cleaner mouth just using baking soda and my hydrogen peroxide mouth rinse. I choose that as a preference for me. And anyone that wants to know what I do, that's what I will tell them. So asking me whether to buy Colgate or buy Crest or any other brand is not going to cut it for me. So I hope I answered that question correctly for some person who wants to know.
Thank you. Thank you so much. So Dr. Veronica Ofogune, my sis from California, Dr. V, said, Dr. Ajagbe, you have shared much new information. Thank you very much. Another phenomenal session. Exactly the reason that she keeps coming back every Monday. Great dental education. Thank you. A lot of people are saying this is great information. It's awesome. That's Sister Ganiat Sarumi. She says, how about if it happens when you are sleeping, unconscious? I think she's talking about the grinding. You are talking about that. And my sister Folashade Ko Fakunle said, can you be grinding and not be aware? But she said, thank you, she got the answer. I should read further before I'm asking you. So she got her answer already.
Mm-hmm.
Somebody asked, which one is better? Tower, I don't understand that question. Can you unmute to ask it? Which one is better? Tower.
Okay. I'm asking which one is better, thread fluxing or water fluxing?
Okay. When you use water floss, you're using the power of the water to go between your teeth. Everything you are using, if you don't use them properly, you will it will be counterproductive. Wow. So the first thing is, when you buy water floss, you need to ask whoever is prescribing it to you to show you how to use it effectively. Don't just agree that you read the pamphlet inside the package, because if you do, you will get home and you will not be able to use it properly. Many of these things are not that straightforward for efficient use. So, and in many of the places, they may not have enough time to show you how it works, but it is your duty to ask them to help you understand how to use it properly so you can have the desired outcome. So if you're using water floss or using regular dental floss, you have to use it properly. For instance, when I ask people, how do you use your dental floss? Well, the first thing I ask them to do is to show me how they do it. It's similar to somebody telling me, telling the doctor, yes, you asked me to use 2 puffs of my inhaler each time I have, and then where the doctor now asks, show me how you use your inhaler, and then you puff it in your ears. Well, you will not get any relief from asthma in that case. The same thing with dental floss. If you have gum infection and you use one floss, particularly the plastic bowl type of dental floss that's now available, that you can buy a pack of 200 for a few dollars. If you are using that type of floss and you have gum infection in one area and you use only one of those to floss all your teeth, what you have just done is you have spread infection from the infected area to the other healthy part of your teeth, or the healthy part of your gums. So you don't want to do that. if you want to do flossing, you need to learn how to do it properly. Unfortunately, maybe many people do not have the dentist that will show them, or dental hygienists that will show them how to do it properly. If you watch it on YouTube, unless you really know what you are doing, it may not be useful to you as well. But it's very simple. What I always tell people to do is you cut a strip of dental floss about 18 inches. That is 1 foot 6 inches. If you can, kind of eyeball that, have it long enough, wind most of it on your dominant finger. Let's say you are right-handed, wind most of the thread on your dominant finger, and then the remaining, the shortest part on the less dominant hand. And what you do is you start from where you are, it's easily accessible. When you go inside between the front teeth first, you will wind what you just used on the left finger, and then get a fresh segment of the floss and go to the next space and wrap it up again, get a fresh one and go to the next one. That is the only way you can ensure that you are not spreading infection from one part of your mouth to another part that does not have any infection. So I don't know whether that is helpful, but you definitely need to know how to use the devices that you are investing in before you can get the desired outcome.
But Sam's Club will not teach you how to use water floss. If you buy it.
But that is a choice that you are making. You're buying it over the counter. Many dentists do sell this in their offices. If your dentist doesn't sell it, you can ask the dentist to help you understand how to use the dental floss properly. That's all I can say to you, because it's just anything that you are not familiar with. If you're going to use it, you need help from somebody who knows how to use it.
Thank you.
You're welcome.
Thank you so much. Dr. Ajagbe is a concierge dentist. That means you can bring dentistry to your home. You can do dentistry, by virtual consultation. And so kindly put your information in the chat box so that our audience can access you if they need to. Please do that, sir. Nina here said you have given very informative information. Excellent session. Thank you. And Marian, all the way from Nigeria, Marian Ogutimeng said, thank you so much, Dr. Ajagbe. Very informative session. I have somebody with their hands raised. I'm going to ask you to unmute. Maureen Booker. There we go.
Hello, Dr. Ajagbe. This was very
Hello.
interesting. I'm an anesthesiologist, so I see a lot of this. Now, there are two things I wanted to ask. People who have the deformity, do you actually tell them that they could have a difficult airway with some of the deformities you have? Because they present to us in the surgery center and everything at the last minute, and then we're struggling with the airway. Secondly, just a comment. My daughter refused to breastfeed, and I now realize why her teeth were so crowded. What do we tell parents whose kids refuse to breastfeed to help them with jaw development later on?
Thank you very much. You've asked very important question. The first one is when in surgical centers, when people have jaw deformities, usually whoever is referring them for surgery should at least have noticed that and documented that they do have some jaw deformity, whether it is hemifacial hyperplasia or micrognathia or prognathia or mid-face hypoplasia. Any of those things should have been part of their record. So at least for anesthesiologists, you know you may have a big problem intubating such patient. Definitely, if you observe, particularly if they have micrognathia, and it's an adult, you may have to go to a child-size, tube in order to intubate them. The laryngoscope that you're going to use also will have to be a pediatric type because of the size of their jaw and the fact that it is retrognathic, that is all the way back. So I know you know your job excellently well, and I can't really comment too much on what you do, but definitely anything that has to do with jaw deformity can present with difficulty for anesthesiologists because of the way things are not normal. Either the tongues are tied, or they have a V-shaped palate, and all of those things have effect on whatever you need to do in their throat. And of course, many of those people that have jaw deformities will have mouth breathing, and once they have mouth breathing, you're going to see big adenoids, you're going to see big tonsils, and those are things that can also crowd your space where you're trying to intubate. So I don't know whether that answers your question, the first part of your question. Yeah. Now, the second part of your question is about children who do not want to breastfeed. That sounds very counterintuitive. The reason is, most of the time, children once a child is born and the child is cleaned up a little bit, and the child already cried, and they already cut the umbilicals and tied it, the first thing the baby wants to do is to nurse. So for some reason, to have a child that doesn't want to breastfeed seems counterintuitive. However, that is not impossible to change. Okay? The reason for that is, if the mother is not having enough milk, the child will also know that he's, laboring, and nothing is coming. That might be an issue. If there is no issue with lactation, that is the regular, normal lactation, it might just be that the child has a tongue tie. A simple check, just by looking in the mouth of the child and see if the tongue is tied at the tip, there's no way the child is going to be able to suck the mother's breast, because there will not be a seal, the kind of vacuum they create when the tongue latches on the mother's breast. So that simple exam might be necessary to check. Also, if there is any form of deformity of the roof of the mouth, for instance, if the roof of the mouth is V-shaped, that is very deep, it is going to be very difficult to breastfeed that child. And unfortunately, there is no early intervention for babies yet in the neonatal level. However, as the child gets older, the jaw gets a little wider, and the breastfeeding might become a little less arduous for that baby. So for mothers who nursing mothers, I would say the first thing to do, if your baby is refusing breastfeeding, is to ask the neonatologist to check the mouth. They can recognize the the deep palate, as well as tongue tie. If any of those things exist, then that baby needs help. There is no amount of bottle feeding that will take care of that baby. The baby will be choking most of the time on anything that you put in the baby's mouth. So that would be my recommendation, that the baby should be examined by a neonatologist. And if there is a dentist who is part of the team, they can ask a dentist to take a look as well, or just have a referral for a dental checkup for the neonate.
Well, thank you, but my kid had no problem. She just did not breastfeed. And even if you bottle feed her with breast milk, she spat it out. So maybe
how
she's an exception.
How did your baby survive?
She got bottle fed very early. No matter what you did, even if you expel the milk and put it in a separate bottle, she would spit it out. But she's now 27. So she's
27?
Yes, yeah.
Okay, so how is her jaw? I'm not
Well,
making any
she
diagnosis.
did have
You don't have to do any, you don't have to answer that question. Rhetorically, I'm asking the question rhetorically.
Yeah,
if she
did have, she probably had a small jaw because we had to remove some of the teeth and give her bracers. That's why that's how it's coming back to me now. What happened?
Yeah, I'm glad you raised that up, because I was going to tell you that is one of the recipes for crowding as well as impacted wisdom teeth. And many times when you have crowding and impacted wisdom teeth, the dentist, the orthodontist will recommend extractions. Most of the time they will recommend 4 premolars to be extracted first. And if there's still no more room, they will extract the 4 wisdom teeth. That means instead of having 32 teeth, that child will have 24 teeth. So you can see what I was saying when I started the presentation, that if you do not have enough space for 32 teeth, there will be crowding, there will be misalignment, there will be, a malocclusion. So the thing about extracting the teeth when you have crowding is you depopulate, right? But that does not necessarily mean you still have enough space, which is the reason why many people, after having braces done, they still have to be in retention for the rest of their lives, because if they don't, their teeth will drift back to where they are most comfortable, because they don't have enough space. And that is where the new advancement that I have access to now can change all of that. Now, I'm not selling anything. I'm just saying that there is help for even a 90-year-old who has hope of living for the next 20 years to still grow their jaw. And it is nothing new, but it's just that the new technology is allowing us to see what we have been blindsided by for so long. Now we know that epigenetics can actually cause a reactivation of the stem cells in the jaw bones to start forming new bones and to grow the jaw to the full potential, to the point where the teeth, each tooth will have his own space without crowding.
Wow. Yeah.
So these are available right now. These are not fables. These are not fictitious. This is not sci-fi. This is going on right now. And I have pictures of some devices in my presentation. If we have some time, I can still show them to you and let you see what those things are.
Yeah, you showed it in a previous presentation. And
Okay,
the question I had about that would be, if somebody is wearing that device and they got into an accident and came to the hospital, how do we remove it in a hurry to intubate them?
Well, the simple answer to that is it's not difficult. It's snap in, snap out.
Okay.
It doesn't have any active engagement, is not fixed to it. Any tools is not attached to anything. It's in, out.
Okay.
The patient does it easily without any problem. Now, the device, is a removable device. You do not wear the device during the day when you are at work or in school. You don't need to wear it. You only wear the device in the evening when you are back home. When you're not doing any other errands, you are home, watching TV, doing homework, doing whatever. And then you wear it to sleep. So you actually wear it for between 12 to 16 hours a day, which is when you are supposed to be winding down or be in bed. You understand?
Yeah.
So if you are able to do that, you would not even wear it during the day. So there is no reason for you to be driving with that in your mouth and getting into an accident, or even playing soccer or playing baseball or playing anything. You don't use it during your wake hours when you are up and about. That is why we call it day and night appliance. It's called DNA appliance. It is a biomimetic appliance. Biomimetic means it is mimicking nature in order to stimulate bone growth. That's all.
Thank you, Doctor. Very good presentation. Thank you very much.
You're very welcome. Thank you for the question.
And thank you, Dr. Booker. I didn't realize it was you. I miss you.
Every Monday, this is my favorite program.
Wow. Thank you. I didn't realize it was you. Look at me looking. See, Maureen Booker, and I'm thinking, is that Dr. Booker? Excellent questions. Thank you. Because your question, believe it or not, has helped me to understand a lot more. Dr. Ajagbe, I'm coming to see you. I didn't even know it was at night that you wear it. That will work perfectly for me.
Yeah, I mean, and it doesn't affect your speech. It doesn't affect anything.
Wow.
It's just the device has a patented fixture on it that is very, is proprietary. So when you look at the device, it doesn't look much to you, but you don't know what it's doing because you have no idea. There's certain part of the device that actually creates some micro vibration just by you having it in your mouth. It vibrates and causes the teeth and the bone around your teeth to form. And also, when we activate the jack screw, it stretches the joint. It doesn't push them apart, it just stretches it. And that is what activates the stem cells in the joint to start laying down new bones. So these are so amazing. I mean, it is unbelievable. And this is something that is available. I mean, those who don't know, but it doesn't mean it doesn't exist. So it does exist.
So, Shade Cole-Fakole asked again, what age is too old to get braces done? So you have to answer that question, but I want to interject that I think the DNA is a better way to go than braces, but please, Dr. Ajagbe, answer that question.
All right, let me quickly address this. When you're talking about braces, there are all kinds of recommendations about what type of braces there are. Everybody tries to have a different technology, but one thing you must bear in mind is if you do not have space, it doesn't matter how much force or what direction you push the teeth. If there is no sufficient space for the teeth will voluntarily go back to where they feel comfortable. It doesn't matter. And which is the reason why many people will use retainer, which is fixed. And when you use retainer that is fixed, over time, you get, it gets irritating to you. You want to get rid of it and all of these things. Once you get rid of it, your teeth will go back. That's the downside. That's the downside to braces. I'm a dentist and I've been practicing for 41 years. But I can tell you that every time we apply force or some forces to teeth, and there is no sufficient room, we are tipping the teeth. What we are doing is we are tipping them in order for them to assume appearance of alignment. So we try to create enough space by taking some teeth out and hoping that that will give us enough space for the remaining teeth. But many times we don't. We don't have enough space, period. And so when you do that, the teeth, the roots are packed together by the forces that we apply. And once we release the forces, let's say the teeth are now, they look straight. Everybody's happy. Yay, we're taking braces off. Boom, you take the braces off. In another 2 weeks, 3 weeks, the teeth begin to shift back to where they used to be. And so you say, wow, how much money did I spend? $7,000? Wow, $7,000 just gone down the tubes. Well, sorry, you have not addressed the underlying problem. The underlying problem is no space. The only way to manage that permanently is to grow bone, and to grow normal bone without pain, without surgery, without any kind of inflammatory process. That is what the biomimetic does. Because when we are growing, we don't have pain. You just see a newborn already starting to walk. Was there any cry every step of the way when the baby is growing? No, you never had pain. There was no inflammatory process of that child growing taller or getting bigger than when he was born. So the same thing is what we must do when we are growing bone at any age. And the question, I know you asked about age cutoff. There is no age cutoff for growing bone. Once the stem cells are still alive, it's just turning them on and they will do what they do best. And they're not going to do excessive bone formation. They're not going to do abnormal bone formation because you are not creating inflammation with the device. Anything that causes pain will bring inflammation. So anything that will inflict pain will bring inflammation. And with the biomimetic process and pneumopedics, these are big terms, but they don't mean too much, other than the fact that biomimetics means we are mimicking nature to form the normal tissue without pain, without surgery. That's what biomimetics mean in this regard. Pneumopedics means we are remodeling the upper respiratory area in order for the individual to be able to breathe through their nostrils, not through their mouth. So all of these are possible, and that is what I'm trying to let you know. If you are on this Zoom meeting and you are not taking anything else away, is just to take away this fact that there is no age limit to growing your bone if you need it. We're not growing bone just for the sake of growing. For somebody whose nostrils are always blocked, who is always stopped up, and who is always breathing through their mouth, they need help. Their nostrils must be opened, regardless of the age. And to open the nostrils up is to grow the upper jaw, and the lower jaw will grow with it. The tongue will come forward. So the airway that is blocked in the back during sleep, in obstructive sleep apnea, will be opened up. And that is the reason why they would not need the CPAP anymore. I don't think the CPAP manufacturers will be happy, but that is the way. If I can cure somebody from their misery, because anyone who is sentenced to using CPAP is lifetime. They cannot stop. They can't unless something miraculous happens to them. If they want to sleep well at night, they will have to use their machine, and it's not the most comfortable machine to use. But however, they're trying to do all kinds of things to make it easier, more user-friendly, but it does not address the underlying problem, which is the space. If the space is not increased, the CPAP will be permanent. You have to use it forever, regardless of what your hang-ups may be about that. So I just want to say it again. The jaw bones can be grown at any age.
Thank you. Although a question was, what age is too old to get braces?
There's no age limit.
There's no age too old. So a lot of people here are thanking you. Adirunke is thanking you that this is a wonderful and detailed session. And in Phoenix Art, I don't know who that person is, but thanks you very much for this session, and that they're glad to have listened to this, but they want to know what to do to get their teeth whiter as you grow older. If you just please quickly answer that, and then I'll read something else to you.
Okay. Whitening is a very tricky issue. It's not because you see the advertisement and everybody looks like, oh boy, oh my gosh, I want those white teeth. I'm not going to knock the manufacturers or the advertisement, but it is not always exactly what you see in the ad. There are two things we consider when we are talking about the color of teeth. Maybe your dentist does not have time to explain this to you, but there is what we call chroma, and there is what we call hue. These two are not always exactly the same for everybody. So because somebody's teeth look white does not mean it's absolutely white. It actually has something to do with the amount of yellow and amount of gray that is present in any particular tooth. Any human being, including me, all my teeth do not have exactly the same color. In one mouth, my teeth have different colors. So to expect a completely uniform white teeth, a complete set of uniformly white teeth from a dentist is expecting too much. And most people get disappointed because they can't truly accomplish that with whitening. Because I don't want to give you false hope. Yes, you may get some whitening, but you will not get uniformly whitened set of teeth. That is a honest truth from somebody who's practiced for 41 years. Now, if I want to sell to you, I'll give you a consent. I'll tell you, yes, you can have white teeth. It's going to cost you $750 for 45 minutes. Are you ready to do it? Yes. We can move from one shade to another. If it's acceptable to you, you are happy, I'm happy. Everybody's happy. But the truth of it is, you don't, because your friend or your cousin or your sister had a very good experience with whitening, does not mean you would have the same experience with whitening. So you have to truly need to whiten your teeth. The part of this problem that we face, as if I can call it problem, is that as we get older, the white part of our teeth gets thinner because of the kind of food we eat, the kind of brushing we do, the kind of toothpaste abrasiveness that we choose. You know, when you buy toothpaste that is very abrasive, because you want to have clean teeth, what you are doing is actually you are filing away your enamel slowly but surely every day. If you brush your teeth twice a day, you will actually be abrading your teeth continuously every time you brush your teeth. And what happens is enamel, the white part of our teeth, is translucent. The thinner it is, the more of the yellow part of the core of your tooth will begin to show through. And there is no amount of whitening that will change that. So the only way to have a permanently white transformation is to do what we call veneers. It's like false nails, that women use, all right? There are false ceramics that we can put on your teeth, and they will give you a complete new set of appearance. It will be uniformly white, and they are not very cheap. So if you are able to afford it, I always propose to each person to do 4 teeth on the top and 4 teeth on the bottom, so that they will, when they smile, all the teeth in that corridor will show. I mean, it will be uniformly white, because nobody really looks to the back of your cheek to see how white your back teeth are, unless you smile so wide or you laugh loud, excuse me, all the time, and your mouth shows every tooth in your mouth.
Thank you so much. I have a question here from Dr. Denike. He says, thank you very much for this insightful presentation. And how accessible is the DNA technology to significant percentage of people in Africa? And, I'll seize this opportunity to, thank and welcome again all our participants from Africa, Nigeria, Ghana, Liberia, and, Canada, even, UK. I saw some people from UK and all over. Welcome. Dr. Ajagbe, how accessible is this to our people in Africa?
Well, right now, I'm the only one that I know that is from Africa that is part of this deal. It's a special training that you have to go for.
Where are the other people from that are part of this deal?
Oh, these are in the US. This is basically here in the US. There is the training is very expensive. It costs about $60,000 to go and attend the training, and you get to be exposed to all of the technologies involved in growing the bone without gene modification. No gene therapy, nothing. All we do is stimulate the stem cells by vibration. And that has been working. And in fact, the oldest patient that has received that kind of a treatment that has been documented is 93 years old. And so he's enjoying his 93-year-old life, better than what he ever experienced before. He claimed that he sleeps better, and he has not had any sleep apnea since the treatment has begun. That is a good testimony for that particular individual. In Africa, I do have the ability. That's why I do concierge practice now, which means I can travel to different parts where my patients are. Since I'm not setting up shop in that place, it means I can treat them as their guests and be back to wherever I'm from. And there is no legal issue in that kind of consideration. I can provide additional information to the person who has the question. If they are interested, my info is already in the chat. So you can reach out to me and I'll be glad to give you more information.
Thank you. So
okay.
Much appreciated. So Tower asked again that, can we see the device for the sleep apnea you wanted to show us? So I don't know if that is in your slide deck.
Yes, it is. You can go back to my slides and go to the last 2 or 3 slides.
Okay, so while I'm doing that, I would like to appreciate the person who brought the most people to Medical Mondays this week. As you know, we give gifts to people who bring more than 10 people to Medical Mondays. We name them our VIPs. And if you bring more than 20 people, you are a champion. So again, Hannah and Ephraim, Dr. and Dr. Ephraim and Hannah Ajagbe brought the most people to Medical Mondays, and the gift this week is Amazon gift card. So thank you again for being diligent with Medical Mondays and inviting people. And I encourage everyone to please do the same. Don't miss out on this gift.
Yeah, please go to the last slide and last two slides. Just go to the side. Go to the side and go scroll up onto the last slide. And
okay, these are the last two slides.
No.
Number 39 and number 40.
No, if you go to this, it should be more than that.
That's all I have, sir.
Okay, well, I apologize. I don't know what happened, but
I have this picture.
No, that's not the one. There should be about 40, 42, 43, 43 slides. Okay, let me see. Let me send.
So we're gonna bring you back, and when you come,
the person who really is interested can send me a message, and I'll send pictures to that person. I don't know what happened to those slides there, but on my, yeah, I see. You're absolutely right. I apologize. I don't know, but I should have been 4 more slides after the last one there, and those are the slides for the devices.
Thank you so much for this awesome presentation. And Doc here is congratulating the winners for tonight, Dr. and Dr. Ajagbe. Thank you very much for the great presentation. And they said, please comment, what is better for our teeth health? Chewing bitter or sweet stuff with drinking, direct drinking or straw usage, which is best?
Okay, I don't think it's the taste of what you chew that would determine how healthy what you're chewing is. If what you are chewing is sweet and is natural sweetness, as in fruit, you're chewing mango, you're chewing guava, you're chewing apple and other fruits, well, those are natural sugars. They don't harm your teeth. It is when you are eating predominantly refined carbohydrates, refined sugar, as in milk chocolate, not dark chocolate, the milk chocolate, candies, chewing gums, and other things that just leave the environment in your mouth to be really conducive to bacterial growth. Anything, any kind of sugar that would do that, you should avoid as much as possible. If you can't avoid it, well, do it in moderation. And always remember, when you brush your teeth, you brush properly. So I would not say just keep on chewing bitter stuff in order to make your teeth strong. You may be chewing bitter stuff and still wear your teeth down. And if you don't clean your teeth properly, you're still going to get gum disease and also cavity. So I'm not going to just categorize your choice on that basis. The other thing is, I'm trying to remember. Did you say something about the chewing?
No.
And what's the second part?
Is it better to drink straight or to use straw?
Oh, okay. If you are drinking with straw, it doesn't do anything to avert decay or cavity or gum disease if what you are drinking actually encourages plaque formation. If whatever you are drinking is slushy, you're drinking from all this slushy from 7-Eleven, the Big Gulp, all these things from the fast food, you know, the bottom line is they're selling you sugar in everything you are drinking. So
how about the high fructose corn syrup in there?
Yes, that is even higher in most of the fast food places. However, if you say because you are using straw, you are trying to prevent cavity and gum disease, I think that is that's not accurate. If whatever you are drinking still stays in your mouth long enough to allow bacteria to grow, you will still have problems. I don't care whether you use the big straw that goes straight to the throat, or you use a small straw that, like, you know, the Stara for your coffee. It doesn't matter. Just remember what you are ingesting. If it can support bacterial growth, particularly the bacteria that cause gum disease as well as cavity, you will still get those if you don't clean your mouth regularly the way you should.
Thank you so much. So I have one more question that I want to ask, and then I'll tell you about next week because we have a treat next week also. Dr. Buka's daughter, we know her history. She did not breastfeed. She has the crowding. She's had her teeth removed and all that. Will she benefit from the DNA device?
Well, I mean, if let's say she still has, I wish we didn't identify her, so it's not like we are, you know, breaching any kind of confidentiality. If any patient like that who has had extractions and has had braces done, if their teeth have drifted back, that is, or they are in permanent or fixed retainer, then they can consider the potential of the DNA appliance. If they have stopped using their DNA and their teeth have gone back to where they used to be, maybe not as severe as they were before the extractions and the straightening of the teeth were done, I would say they should consider DNA appliance as well. If the person, in that kind of situation, also constantly has nasal blockage and asthma, and they are mouth breathers, they have to do the needful to have their jawbone grown. Because when we straighten teeth, we do not create space for the tongue in the back. We have not grown the jawbone. We have not opened the nostrils. So all of those problems, if they existed before straightening the teeth, will still remain. So straightening the teeth will make the teeth look beautiful. Maybe they can function a little better, but they will not address the underlying cause, if the underlying cause is jaw underdevelopment.
Thank you so very much. As you all know, we are not establishing care at these programs on Mondays, at Medical Mondays, but we are giving you authentic, correct medical information to help you and help us actually navigate life. I learned a lot at these programs too. And next week, we're going to have Dr. Ajagbe back. Labor Day, Monday, will be here with Dr. Ashby. And so I'm looking forward to seeing you all for another treat. Thank you so much, and have a blessed rest of the week. Thank you.
Thank you.
Thank you.
Thank you.
Dr. O,
Thank
you are
you.
amazing. Thank you.
Oh, thank you. So